Gestational mellitus diabetes, GMD, greatly increases the risk of poor pregnancy outcome, later develop as type 2 diabetes for both mother and child, and it might also increase the risk of other complications. The national prevalence of GMD in Colombia is not known due to a lack of record keeping and quality studies. However, as the type 2 diabetes rates increase, the rates of GMD are also likely to go up. In Colombia, there are not clinical guidelines on management of GMD, helping to reduce the morbidity of the gestational diabetes and prevent its complication in the District of Health System of Barranquilla, Colombia. Developing of a guide to diagnosis and treatment of GMD according to current global regulations. Reforming the local program of prenatal and GMD for the systematic implementation of the update guide. Training health professionals in the diagnosis and treatment of GMD. Implementing protocol for the diagnosis and treatment of GMD within the control program in Barranquilla, expectant mothers. In my family, no one was aware of this disease, but all my family have diabetes. My mother is diabetic, and she had never had the opportunity to tell me to make me the diabetes examination or sugar test. Starting from primary care service of an information campaign to raise awareness of the GMD in pregnant women. Tracking an educational intervention in women with postpartum GMD. The project expects to reach 72% of the pregnant population in Barranquilla during the initial 2 years of the project. It hopes that this percentage will rise to 80% when the 3-year project period will be over. The project will cover more than 90% of the public subsidized by the healthcare system, which provides services mainly to women who have limited access to healthcare. Advances. Designing of the first guideline for the screening and management of GMD in Barranquilla, Colombia. Conformation of Gestational Diabetes Department. Creating a sentinel network. Design an awareness campaign for gestational diabetes with emphasis on adherence to prenatal care in pregnant women. Training 114 healthcare professionals for the public network of Barranquilla District in the detection and treatment of gestational diabetes.
This project expands the range of services offered by health workers in each of these sectors in which we work. Here, we are giving importance to each control, for each doctor who cares for pregnant women, to detect early gestational diabetes.
The care guide that is implemented in the district of Barranquilla, Colombia, is the only consensus within universities and scientific associations. This guide was made with the assistance of international experts. It is also a tool for improving the quality of care for pregnant women. In this city of almost 2 million people, Gestational Diabetes Department has trained 114 health professionals and need to upgrade more than 286 new professionals. The New Life program is training health institutions of the capital that has an increasing population growth. This program characterizes pregnant women with diabetes. Our model is maternal and children care and serving pregnant women at all stages. It is important to establish appropriate measures to prevent complications and death in both mothers and children from the disease.
y posparto o poscesariada.
Recent indicators show that the constant awareness make new life to improve the response of Barranquilla in healthcare. It does so through outreach strategies of the programs that establish good eating habits and frequent practices exercises. This project is supported by a grant from the World Diabetes Foundation WDF, Novo Nordisk AB, and the healthcare desk of the city of Barranquilla.